So a little about myself. My name is Michelle Conville. I'm a respiratory therapist. I have been a respiratory therapist for about 20 years. I am working with Independent Respiratory Services, and we do a lot of work in sleep. I not only have been working with clients with sleep disorders, but I do a lot of education in the community for doctors, nurses, other healthcare professionals, and the community. I presented last year at the FRA Coeur d'Alene meeting, and there seemed to be a lot of interest from that talk. So the FRA asked me to present again this year on sleep. I'm really happy for this opportunity because the more I learn about sleep, the more I understand that healthy sleep is so imperative for our health and for our longevity. So thanks to all of you at the FRA for taking action to improve your sleep knowledge, your members' sleep knowledge, and hopefully your sleep. Okay, so today we're going to talk about the impact of sleep deprivation. I'm going to define sleep for you, sleep apnea, and some sleep tips. The cost and consequences of sleep deprivation in the USA. So according to the RAND Corporation, which is a nonprofit institution that helps improve policy and decision making through research, Americans aren't getting enough sleep. So is a lot of the world, but we're going to talk about Americans today. So it's estimated to cost $411 billion, or about 2.28% of the US's GDP per year. Pretty astonishing numbers. So this study was based on people that get less than 6 hours of sleep a night, and a lot of us are in that boat. So these costs are primarily derived from productivity losses, which they estimate to be 1.23 million missed working days per year from the US workforce as a result of lost sleep. So the lost sleep, when we're not getting enough sleep, it reduces our immunity. When we reduce our immunity, we're more open for infections. Also with reduced sleep, we're more likely to suffer from depression. And there were studies to suggest that we have an increase, 10 to 15% actually increase in mortality. So we're really cutting down on our workforce in a couple different ways. And they do estimate that the individuals that are sleeping less than 6 hours started sleeping between 6 to 7 hours. This could add $2.26.4 billion to the US economy. I have seen some literature on companies that are taking some steps to really talk about sleep in the workplace, because they are seeing that there is a true cost to not having their employees sleeping. So I saw one model where a company is paying their employees to sleep. And the way they're doing that is they're getting them something like a Fitbit, having them take it home, wear it, and then at an established time, say every 40 or 50 days, they take a look at the data, and they've consecutively slept more than 7 hours, they start to give them monetary rewards. It's an interesting idea. It's great to see there's some thought going into encouraging better sleep habits to employees, but the downside of that is some employees don't want to be monitored by their employer. They don't want them to know what their sleep habits are. So I think there's still some kinks to work out in that program. Probably the best way that we can change this is that companies start talking about sleep and start pushing sleep knowledge and health to their employees, and give them a life balance. We've kind of come into this work 24/7 ethic that's happened in our society, and we need to pull away from that and realize that the rest is healthier than the increased work. So as employers, we need to provide those kind of hours that are reasonable, and we need to encourage our employees to unplug once they get home. On the road, the cost of sleep deprivation and fatigue. It's estimated by driving.org in 2015, there were 5,000 deaths, 71,000 injuries, and together those cost about $109 billion in monetary losses in the US. It's estimated that people who sleep less than 7 hours are twice as likely to be involved in a crash than people that sleep 8 hours. When we're not well rested, we have a lot of lack of concentration. Thinking abilities are really reduced. In fact, when we sleep less than 5 hours, it's equivalent to drunk driving. And these statistics really might just be the tip of the iceberg, because it's not always possible to measure that fatigue was involved in an accident. Sometimes we can. Sometimes there's obvious crashes where somebody has fallen asleep at the wheel. But other times we just unless someone admits that maybe they just came off of working 4 nights, we can't really tell that accident was caused by fatigue. At school. So one thing to know about adolescents is that they're actually programmed to sleep later in the night and get up later in the day. It's not, we all, any of those of us that have had teenagers kind of think that they're, well, and they are sometimes just lazy, but they're actually programmed to go to bed later and get up later. It's their biological clock. And it's estimated at only about 1 in 10 adolescents are getting 8 to 10 hours of sleep consistently. And there's many factors in that sleep statistic, but one of the big ones that we're starting to talk about is school. And there's been a push. I know in my community, my high school has changed its hours, and that's to start high school classes no earlier than 8:30 a.m. Majority of the models that I've seen, at least where I live, is that the elementary school kids go to school earlier, and that the high school kids go to school earlier, and the elementary schools go to school later. So it needs to be switched around because our adolescent kids just aren't ready to be up early in the morning. It can affect their academic performance if they're continually sleep deprived. They can't perform as well. If they can't perform as well, that can affect their lifetime earnings, because if their grades are poor, they're not going to get into college and university. Also, we have an increase in car crashes if we aren't having our kids get enough sleep. So by just starting high school no earlier than 8:30 a.m., they estimate that the U.S. would realize roughly a $9 billion economic gain. What are the consequences to your health? Well, not sleeping enough, like I talked about in the prior slides, weakened immunity. There's also research to prove that we have an increased chance of type 2 diabetes, and that's because when we're not getting enough sleep, it reduces the insulin effectiveness on the glucose. We have an increased chance of cardiovascular disease and strokes, and that's possibly because when our body is not getting enough sleep, it puts it in a stressful situation, and we can have high blood pressure in the night, and that high blood pressure might translate to staying during the day, which is a lot of stress on our heart and brain. Increased chances of mood disorders. Current thinking is that sleep loss impairs functioning of a region of the brain that's involved in thinking and regulating our emotions. Massive stress on our body when we're not getting enough sleep, and reduced in life expectancy. And I talked about that before, and it can be as high as 15% reduction in life expectancy with chronic sleep deprivation. It's time to get serious about sleep. The Center for Disease Control and Prevention has declared insufficient sleep a public health problem, with more than 1/3 of Americans not getting enough sleep on a regular basis. Insufficient sleep duration has been linked to 7 of the 15 leading causes of death. I've already talked about a couple, but there's more to that list. So the 7 they're talking about are cardiovascular disease, type 2 diabetes, malignant neoplasms, accidents, infections, stroke, and high blood pressure. So the stakes are high. So now we're going to talk about sleep and make sure that everybody understands the importance of sleep and what's going on when we sleep. All right, so first of all, kind of the foundation of our sleep is our circadian rhythm or biological clock. It's a 24-hour cycle that helps regulate our sleep and is controlled by light and temperature. So before the invention of the light bulb in the 19th century, we easily followed the pattern of our environment. It got dark, we decided we need to go to sleep. When it got light, we got up. But now we've changed that pattern with light and the type of light that we're using. So normally what happens is later in the evening, we have melatonin that's released. So melatonin is a hormone in our brain that tells our brain it's time to power down, you're getting sleepy, you're going to go to bed. In adolescents, like I talked before, their melatonin release is around 11 o'clock. So when our melatonin is released around 9, probably we're going to be heading to bed in the next hour to 2 hours. As you see, we go through different things in our night with our sleep, with our deepest sleep around 2 a.m. Our temperature's dropping. As I said, with this circadian rhythm or biological clock, temperature is an important factor. Our rooms should be ideally in the 60 to 67 degree temperature range. And that can be one interruption that causes with people as they age, is sometimes they want to keep the temperature of their rooms quite warm, and that can lead to restlessness in their sleep. So once our morning starts to come near, the light starts, the melatonin secretion stops, so our brain starts to wake up and get going again. So that's repeating itself day in, day out. We unfortunately can alter this because of our ability to alter light and temperature. But if we try to keep good sleep hygiene and go to bed at a regular time all the time and watch what we're doing in our bedroom, this is the way our rhythm of our body wants to work. How much sleep do we need? So you can see by this that when we're born, we require a lot of sleep. Newborns, 14 to 17 hours. Up to age 18, where we're down to 7 to 9 hours. And you can see in that adolescent age, the 8 to 10 hours. So the 8 hours, that's a minimum. That's, if we got our adolescents getting 8 hours a night, that's a minimum where they should be, not a maximum. Not only do the hours that we sleep change as we age, but also the type of sleep we have changes as we age. So newborns, they have about 50% of their sleep as REM sleep. REM is rapid eye movement. And what that sleep is, it's more brain processing that's going on during that part of our sleep. So it makes sense that newborns are going to have a lot of that because they're brand new and there's a lot of synapses and systems that need to be set up in their brain. So they're about 50% of REM sleep when they're born. By about 18, we're down to about 20%, which is normal for all of us. So as you can see too by this table is that our sleep needs don't really change from 18 on. What changes is our ability to sleep. So sometimes as we age, we have more aches and pains, maybe medications that affect our sleep, maybe more stress and worries. Temperature can definitely be a factor, not exercising enough, not getting out into the daylight to help with that biological clock. Those are all factors that can impact our ability to stay asleep, but we truly do still need the same amount of sleep. So while we're sleeping, we go through 4 different stages of sleep. First stage of sleep, very light stage of sleep. We only stay in that stage of sleep for 5 to 10% of our night. Generally, this is the stage of sleep that when you're sitting watching TV in the evening and you start to doze off and your partner or kids elbow you and say, hey, you were sleeping. And often we'll say, oh, no, I wasn't. It's because our brain is still really active. If you look at the brain waves to the right, stage 1, there's still activity going on. So those small, close waves mean the brain's still doing a lot. So we're still kind of hearing what's going on in the room. So we don't really recognize if we dozed off into stage 1. Stage 1, 2, when we're lying in bed trying to go to sleep, sometimes that's that stage when we kind of have that jerk right before we go to sleep. And that's a really normal thing that happens. And what that is that the brain and the body are kind of out of coordination of what's going on. So the muscles are starting to relax as you go to sleep, but the brain hasn't recognized it yet. So it will send messages to the muscles to increase the tone because it interprets it as you're starting to fall. There's also some theories from way back, if you believe in evolution, that while man was sleeping in trees, the brain sent that signal to the body to tense up the muscles so that he didn't follow the tree and be attacked by predators. Stage 2, a little bit deeper, brain's blocking out a little bit more of stimulation from the room. And if you look at the brain waves, they're starting to get a little bit further apart, they're getting bigger. So a little bit more difficult to wake us up from stage 2 sleep. We spend about 40 to 45% of our night in stage 2 as we cycle in and out of the different phases. We go through 90 to 120 minute phases of sleep. And during that 90 to 120 minutes, how that 90 to 120 minutes looks changes throughout the night. So for example, the first part of our night, we get a lot of our stage 3 sleep. We'll go stage 1, 2, 3, maybe be in 3 for 10 minutes, go 2, 1, back, get a little bit of REM. And we kind of cycle in and out of things throughout each stage, but we stay longer and longer stage 3 for the first third of our night. The last part of our night is when we get more of our REM and not as much stage 3. So Stage 2, again, it's a place where we're preparing for sleep. So our heart rate's dropping, our blood pressure's dropping, our temperature's dropping. Everything's getting ready to put us into a deeper phase of sleep. Once we get into stage 3 is an opportunity for the body to restore energy, to heal, and to give all our internal organs a rest. Body's really busy with all those processes. And when you look at stage 3 or deep sleep on the brain waves onto the right, you can see that there's not a lot of brain activity. Those great big waves mean there's not much going on. So our brain's also taking a break too. So in stage 3, we have growth hormones being released. And in children, that is in fact when they do grow, is in stage 3. So our kids that aren't getting enough sleep, it can affect their growth if they don't get enough stage 3 sleep. For adults, growth hormone is used mostly for tissue repair. So back when we used to talk about beauty sleep, this is truly when beauty sleep is occurring, is in stage 3. That's the repair that goes on. Healing goes on then. So if we're sick, we need to get into stage 3 so our body has a chance to heal. We also need to restore our energy so that tomorrow when we wake up, we don't wake up feeling like we did when we went to bed last night. Stage 4, or REM sleep, rapid eye movement, is the stage when we do most of our dreaming. When we're in our REM sleep, you can see that there's a lot more brain activity, and there's actually a lot of activity going on in REM. We're dreaming, we're processing information, and consolidating our memories. And also there's that part of our brain that helps to work on controlling our emotions. That takes part in stage 4 or REM sleep too. During REM, we're actually physically paralyzed, and it's to prevent us from acting out our dreams. There is actually a disorder where the paralyzation does not occur, and then people are able to act out their dreams, which usually ends up in some pretty dangerous situations because we've all had those kind of dreams where you're running, you're punching, you're hitting. Doesn't work out well for the person that doesn't experience the paralyzed feeling while they're in their REM sleep. So REM's, again, a really important stage of our sleep that we need to get into for proper brain functioning. When we get taken out of those 2 deep stages of sleep, that's when it can be detrimental to our health. So we're going to get into a little bit of sleep apnea, and I'm going to refer back to those deep phases of sleep as what's the restorative and healthiest part of our sleep that we need to get. So why don't we sleep? Well, I tend to think that the reason we don't sleep is because we don't know better. We haven't really talked about sleep a lot in our society. It's just kind of something that happens. It's dark, we get tired, we go to sleep. But I don't think we've really spent a lot of time talking about sleep and talking about the importance of sleep. In society, we've viewed sleep in many different ways, and some of the ways we viewed sleep is that it's really not necessary. It's kind of a waste of time. The less I sleep, the better. I've got better things to do. Current thinking is showing that's completely wrong, is that sleep is absolutely necessary for our health and longevity, and we need to start changing our habits, and we need to start thinking about it. As you can see on my screen, I think we can all agree that these are a lot of the reasons that we're not sleeping. Our electronics in our bedroom, working too much, too late, TV, the binge watching. And then there's also sleep disorders that some people are dealing with. So there's about 80 diagnosed sleep disorders. But today we're just going to spend some time talking about sleep apnea, because sleep apnea is by far the most prominent sleep disorder in our society. So when we go to sleep, it's normal for all of us to stop breathing up to 5 times an hour. It's considered mild sleep apnea if we stop breathing between 10 to 15 times an hour, moderate sleep apnea if we stop breathing between 15 to 30 times an hour, and severe sleep apnea if we stop breathing greater than 30 times an hour. So as you can see by the sleep apnea cycle, when we go to sleep, we lay down, our soft palate or our tongue, all that flesh there, drops slightly back into the airway. Usually that's absolutely fine because our airway stays open, so that air can move in and out while we sleep. Sometimes we get partial collapse of that airway, and what can cause that partial collapse or full collapse could be, as we age, we lose muscle tone in our airway. So if we already had a smaller airway, it's not going to take much muscle collapse to close it. It can be fat cells deposited in and around the airway that put pressure on the airway to close. It can also be weight around the neck that can cause it to close. It can be position of chin. If the chin is very recessed, that's going to put more pressure on that airway to close. So if we're gone to sleep and we've got our tongue falling back a little bit, our airway collapse a little bit, that can cause the vibration in the airway that is snoring. Not all snoring is sleep apnea. Sometimes snoring is just snoring. And snoring can sometimes be remedied by getting off your back. The problem starts to be is when the airway completely closes. So when that airway completely closes, we have an apnea. An apnea is defined as stopping breathing for greater than 10 seconds, and that causes some definite problems. So in our nice stage 3 and 4 sleep, where we're getting all that restoration of our body and our mind, that's when usually that collapse happens. So now if that collapse happens for too long, our oxygen level drops. So our heart has to work harder. So our blood pressure is going up, our heart rate's going up, and the brain realizes it's got to do something about it. So what it does is it takes us out of our stage 3 or 4 sleep and puts us back into stage 2 or 1, or wakes us up completely if the obstruction's big enough. The problem with that is a couple things, is that if I don't get enough stage 3 and 4 sleep, it's going to be detrimental to my health. It's going to be detrimental to tomorrow, because if I don't get enough REM sleep, I'm not going to be able to think clearly, concentrate, those kind of processes. Maybe remember, maybe I had to write a test today or give a presentation today, and now I can't think clearly for it. If I don't get enough stage 3 sleep, I'm just going to feel exhausted. My body's going to be fatigued. Long-term impact to that is that continual increase in heart rate and blood pressure can have a very big effect on our cardiovascular system. It puts it at a much higher risk for heart problems down the road. And this cycle is repeated over and over and over throughout the night. So I've seen sleep apnea as much as, probably the highest I've seen is about 100 times an hour. And what I often say to people is try and stop breathing 100 times an hour. If you were just sitting at your desk, it's exhausting, let alone when you're asleep. So signs and symptoms of sleep apnea: neck larger than 16 inches in men, 17 inches in women. Snoring, and remember, snoring is not always sleep apnea, but it can be a big feature. Body mass index greater than 40. Being male. About 20% of males suffer from sleep apnea, 10% of women. And the interesting thing is that in our society nowadays, about 25% of people suffer from type 2 diabetes. And I'm pretty sure everybody's heard of type 2 diabetes. Sleep apnea is pretty close behind it with 20%, and not many people know about sleep apnea. So we really need to talk about it more and get it out there. 75% of people with sleep apnea are undiagnosed. Another sign of sleep apnea, or part of sleep apnea, can be over age 50, your risks increase. Depression could be a symptom, difficulty concentrating, poor short-term memory, feeling tired, sleepy, and fatigued, waking, feeling unrefreshed, morning headaches, frequent nighttime urination. And what that comes in from is just that the stimulation of the kidneys, when that flight or fight response comes in when we stop breathing for too long, and the kidneys' answer to that is to get rid of the urine. Gasping and choking in the night, high blood pressure, and someone actually seeing that you stop breathing. Treatment for sleep apnea. The gold standard treatment for sleep apnea treatment is continuous positive airway pressure, or CPAP. And what that CPAP does is it just simply puts pressure in the airway, so that holds the airway open. Dental appliances can be used from mild to low end of moderate. And what they do is pull the jaw forward to hold that airway open, so you can't obstruct it anymore. The reason I say they're from mild to moderate, because they generally are only curing about 60% of the apneas. So if you've got someone that's stopping breathing 100 times an hour, they're still going to be severe sleep apnea with a dental appliance. Surgery, not so popular anymore, because what they used to do is take out the uvula, which is that little thing that hangs in the back of your mouth, to increase the size of the airway. The problem with that is that scar tissue grows back, and it actually, then you're back in the same spot as you were. Weight loss, in some people, it's all about weight. So if they've got a lot of fat cells deposited around their airway or a heavy neck, that definitely can be causing the collapse in the airway. So by simply losing weight, they lose the sleep apnea. Screening. I'm not sure how screening works from state to state, but I can tell you in BC, the way we screen is the bottom left-hand corner. That's called oximetry, and what that does, it measures heart rate and oxygen level. When people stop breathing, generally their oxygen level stops, so we can get an indication of how many times they stop breathing by how many times their oxygen level drops. Another test we do in home is the big picture on the right, and that's called a level 3. Gives us more information because we have a band around the chest and we have some cannula in the nose. So now we can detect, is there breathing when the chest is moving, or is the chest moving and there's no breathing? The other type of testing is in the sleep lab, a full polysomnogram, and that for us is not the first route of testing because it's expensive and there's a long waiting time here. And where I live, it's probably about 6 to 8 months, which isn't too bad, but considering someone calls our office next week or today, they'll be in next week to get tested. In BC, people can refer themselves for screening. We don't need a doctor's order to screen, but if we do have to go forward with treatment, then we need a doctor's order. Okay, so the consequences of sleep apnea being left untreated. 77% will develop hypertension, 25% coronary artery disease, congestive heart failure, cardiac arrhythmias. There's a lot of things to do with our cardiovascular system. Increased chance of obesity. There's some hormones that are released in our brain to help us control our appetite. Those get depressed when we don't get enough sleep. The medical costs, untreated sleep apnea costs Americans about an extra $4.3 billion per year. Sleep tips. So probably one of the best things you can do for yourself, for sure, is have a regular sleep schedule. Going back to that biological clock, that's what that biological clock wants you to do, just to establish a regular sleep schedule. Get regular exercise, helps us be a little bit more tired, gets us out into the daylight, especially for those of us who are sitting in offices all day. Remember that light has an impact on that biological clock. Alcohol in moderation. Maybe not used to be, but people talk about the nightcap. Well, the nightcap might help you fall asleep, but it changes the pattern of your sleep. If you've ever had too many drinks and gone to bed, and you may sleep still 8 hours, but you don't wake up feeling well rested. The problem with that is that when we have too much alcohol or some alcohol, we might just stay in our stage 1 and 2 and not get a whole lot of stage 3 and 4. So that's not going to give us quality of sleep. Keep the bedroom cool. 60 to 67 degrees is recommended. No electronics in the bedroom. The bedroom should be dark and only for sleeping. The problem with the electronics is a couple things. The blue light that comes from those screens can depress our melatonin release. So instead of it being released around 9, it might not be released till 11, but you want to go to bed at 10 and your brain's saying, no, not tired. So if you are going to be using a computer before bed or a phone before bed, make sure you have something like F-Lux on it to reduce that red light or that blue light that comes from it, and puts more of a red light on it that doesn't have that impact on our melatonin. Also, the problem with electronics in the bedroom or electronic use just before bed is it just gets your brain going. And so you want to hit the pillow and your brain's wide awake. No caffeine afternoon. Power down an hour before bed. Think about sleep. Make it a priority. Work through your thoughts about the end of the day, and that some of that can be if you're feeling really stressed about a certain thing, you're thinking about something too much, write it down. Tell yourself that you've written it down, it's there, so I don't have to think about it anymore. I'll look at it again tomorrow. Avoid heavy late night meals, and that's because our body's not meant to be doing a lot of digestion in the night, so that can interfere with our sleep. If you need to nap, it shouldn't be more than 20 minutes. And the reason for that is because after 20 minutes, we start to get into a deeper sleep. And once we get into a deeper sleep, it's harder to wake us up. And we kind of feel more groggy than we feel refreshed.